prescribe an amount of solution and additives, the rate. So it says over 8 hours. It's now your obligation to compute how many drops will you give, how many drops per minute, because we usually compute for per minute or over an 8-hour period. The rate or volume of infusion, the duration of the infusion, so it's 8 hours, the doctor's signature. So is this a complete order?
Somewhat, not until the drops are on.
Yeah. So there are orders like that, and you as a nurse need to know it. So that's why in nursing we learn how to calculate. Yeah. So patient teaching, we have to explain what we are going to do with the patient, why we're going to give an IV therapy to them. They will be nervous. Will it be painful? Will I get sick with it? Or maybe I don't need it. So you have to educate the patient. Because there are those patients who say, no, I don't need antibiotics. No, I don't need fluids. I'm okay. Oh, I just drink. Yeah. So we have to educate them. So tell the patient why the therapy is being done, describe the procedure in detail. So you explain how it's being done, how to insert the IV, reassure the patient that the pain will be transient. Expect the patient the IV fluid to feel cold for a few minutes, and then the patient should report any discomfort. You know what? Patients who are virgin cases in hospital, sometimes they don't know anything about IV infusions. Even if their IV site is already bulging, they still don't know. So we have to tell them what to expect. IV infusion. And then when it's big, and your charge nurse or the doctor will say, why is it that it's already bulging and nobody informed well, the patient didn't tell me.
I've seen one of the lower extremity IV site to the lower foot, and then the patient family saw like it was just, it looked like he was infiltrated, it looked like he was swollen compared to the left foot. So those are easy signs, right? Like,
yeah, and that's a no-no. If it already becomes big,
this is big. I see.
That's your fault. If you allow that to happen, yeah. And here, because we have the compartment syndrome, when this becomes big, so it will already hinder the flow, the circulation here in your hand. So the compartment syndrome means every structure here is already, there's no more circulation, so the structures will die, the nerves will die, the tissues will die.
Yeah, that was.
That's a big blunder.
So that just means no one was checking it, or like they just said, here, continuous fluids. So
Yeah, I remember our nursing instructors or teachers were always telling us to always check the IV site, like at least every hour or so.
Oh, your phone is charging right now. We are live on Periscope.
we draw aspirate blood.
You want me to
See
stop
if
it?
it's still going in the right place. So
Can be, but then you just look at
Is
it.
it live?
Just look at it. Is it flowing, and is there any changes? Because when it's already extravasated, you will see that there is